The current push to introduce a system of checks and balances into the executive handling of the coronavirus pandemic in Ohio is an essential part of a healthy democracy and should not be considered an attack on Dr. Amy or Governor DeWine. Rather, it should be thought of in the context of academic peer review. We are now 2 months into this and have been fortunate enough to have only had 1,200 coronavirus deaths to date in Ohio. The time for urgency is over. You can choose to credit Dr. Acton for this result, or you can choose to blame the lower than expected lethality of coronavirus. It doesn't matter. We're now at a point where policy positions can be scrutinized, debated, and acted upon in an environment where everyone has an opportunity to hear their voice heard. Good decisions are rarely arrived at by single-person rule or silencing dissent. And this is because everyone makes mistakes. Dr. Acton is no exception to this rule. In fact, she's made several over the past few weeks. Putting aside the more amusing examples that I've been highlighting on my Fact-Checking Dr. Amy series on this channel, it's also worth remembering that she originally projected that over 100,000 Ohioans had coronavirus on March 9th. This was repeated multiple times as the justification for the stay-at-home orders and economic lockdown that occurred in Ohio.
As Dr. Acton indicated, we project we have about 100,000 people at least who already are walking around with the coronavirus. And what the experts tell us is that this number will multiply, will double every 6 days.
Other experts questioned the 100,000 number at the time, but there was neither a time nor platform for these experts to express their positions and be heard. By the end of March, only 96 Ohioans were known to have died of coronavirus. That means that either the 100,000 number or the lethality of coronavirus were off by several orders of magnitude. On March 28th, Acton released a model produced by The Ohio State University that projected that by the end of April, 10,000 Ohioans per day were going to be getting infected with coronavirus. And this was a best-case scenario that we could hope for only if 100% of Ohioans participated in extreme social distancing. The existence of this model was a direct repudiation of Acton's original 100,000 number. During the weeks that followed, confirmed infection rates fell well below expectations, and the model was revised on April 5th to show a peak of around 2,000 infections per day occurring in an earlier period in April. Acton framed this error as a victory for all Ohioans and congratulated everyone for a job well done, but she never addressed the obvious question as to why the model parameters were so far off that the best-case scenario had to be revised down by a factor of 5. In the weeks that have elapsed since this revision, random testing at Ohio's Marion and Pickaway prisons have shown huge numbers of asymptomatic infected carriers. This is being backed up by random or kind of random antibody testing that's happening all around the United States. It's starting to look like the original OSU model wasn't that far off, and the reason that we weren't able to find the infections was because these people did not know they were sick. Despite these developments, Acton has decided not to set aside some of Ohio's testing capability for the purpose of doing random testing, so that we would have numbers that we could extrapolate onto the general population to see how far the virus has spread. All this is to say that the window of time where decisions had to be made in a matter of hours is over. It is time for our General Assembly to provide a platform for experts to challenge Dr. Acton's claims, the way academics have been doing for decades in peer-reviewing research ready for publication. Putting aside the question of medical accuracy, we should also not forget the fact that the scope of Dr. Acton's expertise is limited to medical science. Our General Assembly is elected for the purpose of looking at a much bigger picture. It's their job to understand that Ohioans have concerns not only about coronavirus, but also about unemployment, education, housing, and the overall social well-being of their communities.